I want to welcome everyone today to our webinar on what's now called SEA285 Housing Matters. I'm Lisa Kelly. I'm Executive Director of Mental Health Awareness of Michiana. Our organization is located in the northern Indiana area. We may have some participants today who are not familiar with where Michiana is. We're in northern Indiana, the St. Joe County, Elkhart County vicinity. Our mission is to improve the quality of life for individuals in our community who are managing mental illness or mental health concerns. And we work on initiatives that eliminate stigma, that remove barriers to mental health care, and ultimately build collaboration in the community. So we have a number of programs. If you're interested, happy to share our website at the end of today's webinar. So we are talking about this bill primarily because our concern is for the people who are most affected or who may be most affected by it. So folks with experiencing homelessness, there is a 50% prevalence of mental illness and substance use disorder for those individuals who are unhoused. And so we know that the population that we're working to walk alongside and try to support and help them as best we can are really, in a position with this bill that they may be, ultimately deemed criminals and put into jail. So we want to talk about this bill because of the concern about the effect it'll have on our community. And from a mental health advocacy perspective, I can't help but think about our legacy, right? That the history of how we treat people with severe mental illness. You go back 100 years and people were locked up, and if you were poor, you had far different options than if you had resources. And so certainly, the folks that we're talking about today are the most vulnerable in our community. So we as a community, we as an organization, care about these things, and we want to make sure that people in the community understand the legislation, as well as what we are concerned about the local impact will be. So I am delighted that we have two experts with us today. Marcy Thompson is from the National, I'll make sure I get this right, the National Alliance to End Homelessness. So Marcy's actually going to talk about the picture nationwide. So the bill, Carl's going to talk more explicitly about the bill, and Marcy will actually give us the broader picture, the broader perspective on what's happening around the country and her understanding of what this local legislation means. And then we'll switch back to Carl, who give us more of a local impact and concerns, that we should just be paying attention to locally. So Carl is our Director of Homeless Services for the City of South Bend. So we've got the national picture and the local picture reflected here. So I'm going to turn things over to Carl to talk briefly about the legislation. I will let folks know that during the presentation, use the chat box to put your questions in, and we will be monitoring the Q&A and the chat and make sure that we get as many questions answered as possible. So Carl, welcome, and also welcome to everybody who's part of this conversation today.
Thanks, Lisa, and thank you, Marcy, for joining us to help give us some national understanding. I'm going to start with a brief overview of the SEA 285. I put the link in the chat, and I'm sharing my screen so you can see the website where you can go if you want to learn more and read the full text of the bill. A couple of things I want to highlight in this summary statement that you see there on your screen. We are not going to be talking today about that first part about eligibility criteria. That applies more to housing providers who are working with the unsheltered and with the unhoused. We're also not going to focus on gravely disabled. That is going to be more of a wintertime concern when people are refusing to come into emergency shelters such as Weather Amnesty that we have here in South Bend, provided in amazing ways by our Center for the Homeless. But we are going to be talking about what it means that land owned by the state or a political subdivision is creating challenges for people who are on public areas. And we'll be talking also about the legal status of a Class C misdemeanor that people are facing. We'll talk about some of the prohibitions that are in place and the limits of what we can do as local government to impact that. And then we'll also talk about some of the implications with having to report the numbers of arrests that are made by law enforcement to the state legislature, and about some of the diversion programs also. We're really going to try to focus on what are the diversion programs that we have available to help people, whether that is the need for shelter, for mental health services, or for recovery options. Lisa mentioned about how this group MHAM focuses on mental health. Numbers suggest that about 50% of those who are unhoused, for example, have a traumatic brain injury. That's just one category of where we see mental health being impacted by people being out on the streets. I also like to say that 100% of the people we work with have some level of PTSD. It is traumatic to be on the streets, to not know where you're going to sleep at night, to not know what or where your next meal will be, to not know who you'll come across, to have limited privacy and safety. It is a traumatic experience. And the work that we're doing here in the city of South Bend is to recognize the trauma that people are going through, to help connect them to resources, and to be able to help get them the support that they need. And we'll talk about what this bill does in reality for people who are very traumatized and impacted. That's just a brief summary and overview of that legislation that goes into effect July 1st. I'm going to turn things over now to Marcy to give us a national picture of some of the trends information that she's seen.
All right, thank you so much, Carl. And let me see if I can now share. Okay. All right, are you seeing my slides?
Yep, you're good.
Okay, all right. Well, good afternoon, everybody. Thanks for being here today. So Marcy Thompson, as Lisa mentioned, I'm from the National Alliance to End Homelessness. Our mission spans across a broad scope of activities. We conduct research and analysis, help build the capacity of the homeless sector, and really work towards an end to homelessness through policies, connecting with communities, building awareness for the public, and working to expand the impact of people with lived experience in the field. All right. So I'm going to be really talking broadly about the national perspective here. So the Alliance defines criminalization of homelessness as punitive policies which seek to punish people for experiencing unsheltered homelessness through the use of fines, citations, arrests, and jailings. Now, I think it's important to be clear that not all policies that that could be, for example, a camping ban. Not all of these policies are designed with the intention of being punitive, but the resulting effect is still the same. So again, this could include camping bans, prohibitions on panhandling or eating in public spaces, or any other restrictions on life-sustaining activities. Criminalization is not new, it's not recent. These types of laws and practices have existed for decades. Years ago, when I was at HUD, we were tackling this then as well. In 2018, the Ninth Circuit Court, in the case Martin v. Boise, held that cities cannot criminally punish people for sleeping or camping in public spaces when no adequate shelter is available. Despite this ruling, we started to really see an uptick in these laws, particularly in 2021, when Texas became the first state to institute a statewide camping ban. Increasingly, we have seen think tanks, often out of the state in which these are being passed, pushing template legislation from Kentucky and really across the country that largely address the symptom of unsheltered homelessness, but not the root causes. In June 2024, the Supreme Court's decision in the Grants Pass versus Johnson case overruled the Martin v. Boise decision, ruling that enforcement of generally applicable anti-camping laws does not violate the Eighth Amendment. Since then, cities across the country have introduced over 320 bills criminalizing unhoused people, and nearly 220 of these laws have passed. These laws, particularly at the state level, have evolved over these years, past kind of that template camping ban, to also encompass other concerning elements. For example, criminal penalties for providers if participants use substances in a drug-free area, and expanding where those drug-free areas are to be close to places where people would seek assistance. Grounds for residents to sue, non-homeless residents to sue municipalities if they're not clearing encampments quickly enough, or weaponizing audits against providers and COCs in order to gain access to confidential data. So it is not a surprise that these laws have been growing in hostility in light of what we're seeing out of the current administration's response to homelessness. Prominently last summer, there was an executive order titled Ending Crime and Disorder on America's Streets. And this executive order directs federal agencies to impose a multitude of honestly harmful and outdated policies and practices for addressing homelessness. Collectively, they aim to defund and dismantle the foundations of homelessness response in the United States, while really retreating from the federal government's role in supporting communities across the nation. So we are seeing some of these, their policy approaches play out in funding opportunities like HUD's Continuum of Care NOFO. So the bill that has passed in Indiana follows the trend that the Alliance has been tracking, particularly the bill component focused on creating a statewide camping ban, which is similar to what we've seen in states like Kentucky, Florida, and Tennessee. Under Indiana's bill, a person may be charged after 48 hours. After 48 hours have passed since the issued warning, and the person remains within 300 feet of that location. If a person who knowingly or unintentionally uses land owned by the state or a local by the state or a subdivision for unauthorized camping, sleeping, or long-term shelter, they commit a Class C misdemeanor. Municipalities are prohibited from not enforcing these measures, and private citizens can take legal action. And while this bill and bills like this can certainly in and of themselves move people out of sight and out of mind, they do not solve homelessness. Okay. So I want to just talk a little bit about why this matters, like why this rise in these types of laws threaten the progress that communities have made, which is hard sometimes to see on the surface when we see more homelessness, when we see homelessness growing, and not necessarily taking into account the systemic factors that are bringing more and more people into homelessness every day. So again, no matter the intention or extent of the law, the research and evidence consistently show that laws that aim to make homelessness less visible have some things in common. When people are constantly being displaced with no place to land, no place to rest, they are disconnected from their service providers and support networks. This displacement and disconnection sets back progress, can create distrust, and places an even greater burden on frontline staff, like Carl and his team. Funds are diverted away from evidence-based solutions that are focused on getting people into housing, from which they're able to engage in wraparound services based on their individual needs. Instead, people are probably less likely to request assistance and more likely to come in contact with emergency rooms and other emergency services, which are a much higher cost to the public than providing housing and shelter. Enforcement of these strategies adds greater responsibility on local law enforcement. Entities without adequate training, increasing the risk of negative interactions and diverting law enforcement time and resources. And, I think Carl kind of alluded to this, and Lisa as well. The experience of being homelessness in and of itself is traumatic. Imagine the most unsafe and vulnerable that you have ever felt in your life and multiply that by 1,000. Add on top of that, knowing that just being in public spaces places you at risk of being arrested, having these consequences set out for you. These create more stress, distrust, and when displaced to less visible locations, can place people at even greater risk of harm. They can lose important papers, and medications can be easily lost, which can both impact a person's both their health, but also getting back into housing. Often getting into housing requires identification and other materials that are easy to get lost in these sorts of displacement efforts. And criminal records, an arrest, a citation, a misdemeanor charge, all make it less likely for these folks to be able to get employment, to get housing, and access to other benefits that they're going to need in order to get out of homelessness for good. So what we've seen in states that have implemented similar statewide laws, like in terms of what the impact, there's been no discernible or attributable impact on unsheltered or overall homelessness numbers. There's been an increase in arrests, citations, and cycles through the criminal legal justice system. There's an increase in barriers people face to regaining housing and a diversion of law enforcement time and resources, taking away from other priorities, such as solving for violent crimes. So what's behind these laws? And I kind of alluded to this a moment ago, but I think if we take a look back, so often when we talk about homelessness numbers, we focus really specifically on the point in time count from every January. That is just this one snapshot from year to year. And since 2017, there's been an upward trend in the number of people experiencing homelessness during that point in time count. This last report from 2025 is the first year that we finally saw numbers start to go down. But during this time, during these years, homelessness has become far more visible to the general public as unsheltered homelessness in particular has increased. And that puts a lot of public pressure on decision makers to try and solve a really complex problem. Again, it's easy to draw a conclusion that if you're seeing more people that are homeless, then the homelessness response systems and the strategies are not working, and they're failing. But if you zoom out, you can find more of the story. In 2024, across the country, 17,500 people became homeless for the first time every week, every single week. That's more than 900,000 people over the course of the year. During that same time period, COCs had the resources, or continuums of care, homelessness response systems, had the resources to assist about 350,000 people exit homelessness. The math doesn't math in this context, right? The fact is that there is a persistent and severe affordable housing crisis that continues to leave 7.3 million renters, or 7.3 rental homes unavailable and inaccessible to the people that need them. And at the end of the day, that is not a problem that homeless service providers, frontline workers, it's not something that they can solve for. So I think that what happens is lawmakers see this rise. They're getting a lot of pressure from folks in their community. Building new housing, creating more housing takes time. It's not something that can be done overnight. Passing a law, implementing a law, doing an encampment clearance feels like something that they can do in the short term. And unfortunately, that can be really short-sighted because it doesn't add anything to the overall long-term goal. So what could they be doing instead? So evidence and experience shows investing in partnerships, scaling resources, and providing a community-wide strategy to move people from the streets into permanent housing is always most effective, particularly when you have access to available, affordable, and quality supportive services. Even in states where there is such a law on the books, state and local partners can still be pursuing those long-term solutions while adopting harm mitigation strategies in the short term to keep people safe and prevent further trauma, rather than creating more barriers for them. At the top of that long-term strategy should always be investing in deeply affordable housing, not just for people experiencing homelessness now, but for the community. It benefits everybody when everybody in your community has access to quality, affordable health care, as well as affordable housing. So in these situations where you have a law, it's passed, now what do? It's past the time to advocate or oppose one way or another, or be for it. It's here. So what can you do in the state of Indiana if you're a homeless service provider or you're a mental health practitioner, um, to make sure that the people that you're working with are safe, making sure that your community is also still working to address homelessness uh, in a in an evidence approached way. All of that feels really critical. So the first thing is expanding partnerships. This includes with healthcare providers, especially behavioral health and providers that treat substance use disorders. It could be legal aid organizations, law enforcement, and more. People experiencing homelessness need real resources and alternatives to the streets, jail, or institutionalization. The common denominator in solving homelessness for any person is housing, but every single person has a different set of needs in terms of what services they need, whether it be what they have access to in terms of healthcare, support networks, employment. All of those things require an individualized approach. So expanding resources to allow for both housing and those individualized services is really important to scale up in a way to address the need. At the same time, everybody can agree. We can all agree, whether we agree on the approaches to this or not, we can agree that encampments are not safe or healthy places for people to live. But punishing people for system level failures or not having enough investment in the community isn't going to be the way to solve it. But having a short-term plan on how to address the urgent and pressing needs today while also working for a long-term strategy feels like the best option. So this can look like developing and deploying interim strategies that are time fixed and provide people with a safe, healthy place to sleep, while still, again, pursuing what those long-term investment strategies are going to be. I want to just talk briefly about strategies to engage with law enforcement. They're going to be a critical partner in this. They're the ones that are responsible for implementing and enforcing laws like this that are passed within the state. And so, often when we talk to members of the law enforcement community, what we hear is, that they see that arresting that there is no way to arrest people arrest the community's way out of homelessness. They don't want to see their time being diverted to clearing encampments instead of really focusing on more significant crime within the community. In fact, the Indiana Sheriff's Association opposed the bill that is now passed. But again, it's here, so how do we have a path to move forward? So positive examples of partnership and collaboration could look like diversion programs and policies so that law enforcement can rely on the first frontline staff to respond before enforcing an anti-camping ordinance. Joint advocacy efforts, accurate data collection, all of those things working in tandem together and seeing each other as partners can really help, again, mitigate harm, but also create a more effective approach within the community. And then I'll just briefly mention some of the, again, policy priorities within the state. And I know we're going to maybe talk through more of this in a little bit, but as the state kind of moves into implementation to help mitigate any potential negative consequences, there are ways to push for greater transparency in order to track outcomes. Ask decision makers in the state capitol for more resources to, again, address those long-term needs. And at the federal level, make sure you're talking to members of Congress to increase and expand federal funding to make sure that they are doing their part. So I will stop sharing my screen and turn it back over.
So Marcy, thank you so much for that. We're going to be switching over to Carl shortly, but I did want to give folks an opportunity to ask questions. I actually have a question for you as people are maybe typing into the chat box. You said something about when you're describing the legislation that private citizens can take action. Can you just expand on that for what does that actually mean?
So when there's a law, sometimes there are laws that say if there's a community member, I'm a private resident in my neighborhood. There's an encampment. I can reach out to the municipality and make a complaint. I can uh, uh, it kind of empowers the people within the community to be able to enforce the law on their own, absent the law enforcement, which makes things really subjective as well, and can be problematic.
Okay, thank you.
Mhm.
Okay, so one question, can you please clarify the numbers you stated earlier in regards to the number of newly homeless people? Were those numbers statewide
National.
or nationwide?
Yes, definitely nationally. But I think pretty consistently, we hear at the local level, at the state level, that inflow, meaning the number of people that are becoming homeless, is exceeding the number of people that they're able to exit. So if you have a finite number of beds and all of those beds are full, you have more people coming in and there's nowhere for them to go. This is what happens. And Carl could probably say more about what's happening at the local and state level.
Okay, thank you. I will anecdotally say that, we know that there's about 3,000 evictions a year in St. Joseph County alone. And not all those folks are becoming unhoused, but they are all in this vulnerable moment. So thank you, Marcy, so much. We're going to switch over to Carl, who's going to be talking more about our local community and what we're anticipating locally.
Thanks, Lisa. Let's take a deep breath. We've heard some really sobering statistics nationally about people who are in need and about also the challenges that people are facing for a variety of reasons and how new law here in Indiana and other states are not helping people but causing harm and more difficulty. I'm going to share some of those state statistics and local statistics to help ground us understand the problems that we're seeing here. We will also share a link to these slides so that if you want to be able to look at them more in depth, you can do that also. We are seeing homelessness increasing, both sheltered and unsheltered is going up across the state. The balance of state is all counties outside of Marion County are included in that. Surprisingly, we are seeing that it is increasing faster in rural areas, often because there aren't as many services available in those areas, and they don't have the infrastructure that we have, for example, here in St. Joseph County with South Bend especially. As I talk with people in similar positions in other counties across the state, we're seeing a variety of different ways that they are implementing this. Some areas don't see a lot of changes at all to what they are currently doing. Others are planning to enforce a lot more strictly this new law. Some are trying to separate out the services they provide from law enforcement and not get law enforcement involved at all. And a lot of cities really don't know yet what this means. And there's still a lot of uncertainty that other cities across the state are facing, unsure of what 285 will mean in practicality. Angela's question about people who are unhoused within this state, it's interesting to look at the breakdown of numbers and to see how over half the people are first time. So we're not necessarily talking about chronic people. Those are still a part of the system, almost a third. But more than half are people, because of the economic reasons that Marcy mentioned and other factors, are experiencing homelessness for the first time. And that is sobering to think about why that is happening. For some local context on some of the financial numbers, here's one slide that looks at the increasing rent costs that we see for both homeowners and renters, and the amount of hours you'd have to work at a minimum wage job to be afford different levels of sizes of housing, or what your hourly wage would need to be to work 40 hours a week. And it gets higher and higher as the years have gone on, and we see some of that challenge. So that's one example of the economic impact that we see that, again, as Marcy said, can really only be solved by more housing. And we'll talk about that also. For some local numbers, once a year on the point in time count nationwide is when we go out on a night in January to talk to people, to count those who are both sheltered and those who are unsheltered. This is a breakdown in some of the statistics of people that we are seeing here in St. Joseph County that we interacted with. We don't have official numbers yet for 2026, but unofficially I can tell you that that unsheltered number is cut in about half. And that's because of the great work being done again at Weather Amnesty at Center for the Homeless, but also the fact that we have a church now providing overflow to people who expanding capacity so more people can have a bed or a cot to sleep on, and a great local agency, Our Lady of the Road, that's been helping put people in hotels also when necessary to get them out of the extreme cold. The biggest demographic shift that we've seen that again speaks to some of the economic challenges is more older adults experiencing homelessness and being in shelters or at Weather Amnesty or out on the streets. People who have more medical needs, have more mental health challenges, have less physical ability is part of that challenge that we're seeing changing. We are doing a lot of great work with expanding capacity for housing. You see here some of the numbers of those who are in supportive housing, people who are rapidly rehoused to prevent them from having a chronic homeless experience, and the total number of beds, again, across St. Joseph County of what we see people getting the help and support that they need. And so these numbers are encouraging to see how we are continuing to grow and build more supportive housing and use what funding we do have from the federal and state level to create more housing options for people. Another category of vulnerable people that we see here in St. Joseph County is among our children's population. McKinney-Vento is a federal program that provides support services to families that don't have stable housing. So here's numbers from this school year where we are tracking kids in various schools who are experiencing difficult situations. And so we have some great partnerships. Again, as Marcy mentioned, how important that is with our school corporation to be able to track and know what schools need more resources and what social workers need support. When we break those down by categories, this is really where it's helpful to see the total number of students. The largest category is doubled up, so sleeping on someone's couch, for example, maybe even a spare bedroom, but if your name's not on the lease, that's not stable housing, and there's a risk that not only you could be asked to leave in a short term, but also the person hosting you might get evicted also if it's a problem on their lease to have additional people who aren't on the lease within their unit. We have a fair number who are in shelters, whether that's the Center for the Homeless again, Hope Ministries, or the YWCA, which addresses domestic violence for males and females and families within our community. We have some areas, if you're familiar with the South Bend area, up in Roseland is where a lot of people are staying in hotels and motels, and the schools then up in that area are seeing more people in needs who are up there. Thankfully, this past year, we haven't had anyone involved in DCS, but we have had some families unsheltered in their cars or on the streets uh, that we've been able to work with. But the most encouraging number that I want to highlight is that last one about permanently housed, that because of that collaboration work, because we were building more housing, because of the amazing social workers that we have in our school system, they are able to get more students housed and to get them the support and care that they need. And so that is very encouraging. Um, I want to briefly mention my website if you want to learn more or follow up with me. We have lots of great resources and FAQs there on that website, where if you want to get more details about resources and support that I offer, you can reach out to me there and see some local maps that we have available also. But I want to talk for the rest of my time about what we are doing to address the needs of people who are traumatized, again, being out on the street, and the way we're trying to work with this new state law that, again, that is going to affect on July 1st. One of the big things that I do is training people on de-escalation. I've been doing this with different agencies, with our police, with different city departments. Here's one sample from Ryan Dowd. He's known as the homeless librarian out of Chicago. And he does a lot of great material that we're able to share about ways that we can improve people's interactions. This is kind of helpful information that I'm able to do with police and then with other people who are encountering people who are experiencing the trauma of being unhoused. It's important for us all to understand how difficult it is, and for us as a community to develop the empathy and respect that people need when they are in difficult situations. And so for those of you who represent organizations, feel free to reach out to me, especially if you're locally here in South Bend, if you'd like me to come and do a training so that you, as Marcy mentioned, we need to all be equipped and encouraged for how we interact with people. If you and your staff or your group would like to be trained on how to better interact with people, not only the resources on my website, but ways to have conversations with people and connect them to resources, I'm glad to be able to do that, especially if you're here in South Bend. We view Senate Act 285 as a tool here in the city of South Bend that we are going to use to help connect people to services. And we want our law enforcement to know about the different resources we have, whether that's for shelters, whether that's mental health services, or whether that's substance use. When we think about the cycle that people go through, this is sort of a breakdown. It's not always linear, but these are the different steps that we see people taking. So, for example, someone this winter may have been sleeping outside in a public area, and we have been very successful with weather amnesty to get most of those people indoors. And what's been encouraging is through doing that and providing a low barrier or high access option, that people then move into different shelters, such as Motels for Now, or they move into a residential program at the center or Hope Ministries. And so we saw about 20% of the people who came into weather amnesty this past winter move into one of these other programs where they could get round-the-clock care and coverage. That is what we want police to know, that we don't need to arrest people to solve homelessness. And we want our state legislatures to know this also, but that by providing low barrier housing options, people are taking advantage of that and we're moving them into more stable housing situations. That's the way, as Marcy mentioned, naturally, we see lives being transformed and things being done to help people who are in crisis. Here's some visuals of some of those places that help move people out of encampments that we have experienced here in the past into locations where they can get care at the Motels for Now, at the Center for the Homeless, or moving into apartments such as affordable housing that's being built, or low-income housing at places like Cedar Glen. From there, there's lots of other options that people may move into when they need supportive housing. We currently have about 65 units of permanent supportive housing at Oliver, Hope, and Thrive. We also work with other groups that provide group homes, whether through Center for the Homeless, Oaklawn, or Life Treatment Center. And we're continuing to build more supportive housing. It's one of our commitments here in the city. South Bend Heritage is currently building single-family homes that are going to be scattered across the city where we'll provide mental health and recovery support services to people there after getting them housed. And there's lots of other programs you see there on the slide that I'm not going to get into today. Uh, I'm going to jump to mental health and talk about all the different services that we work with to help provide mental health care for people. A lot of this involves law enforcement already, working with our county crisis service unit. And I'm also one of the trainers and part of the steering committee for our crisis intervention team. I know some of them are also on the call, and that's been a transformative way over the past number of years to do ongoing training for people who are in law enforcement across different departments, for them to know about the resources for the unhoused, to learn about de-escalation, and for us to collaborate together. We know that this is a common need that often police are having to answer. Here's a breakdown of Code M calls within the city of South Bend that we see that are coming in both to police, but also to our mobile crisis center, mobile crisis team being run by Oaklawn, and our crisis center being run by Oaklawn, and phone coverage that's being done by Oaklawn also. Helps us see the reality that many people are in mental health crisis, whether they are housed or unhoused, and that there is a need to provide more services. And so we are seeing this law as a tool again, where we're going to equip our CIT officers and others to know about the resources, how to connect people with mental health services that they need, whether that's at Oaklawn or, as I mentioned, other places such as Bowen Health that's on the call, Imani Unidad, which is developing their own mobile crisis team. Broadway Christian Parish is another meal site and place that is helping people connect to services. We have a great connection of services that we are helping people get involved with. One of the challenges, as I mentioned, about being gravely disabled in that new state law is that it expands our emergency detention orders. This is our current rubric that has been developed by CIT to help understand when someone is in need, what's the best location for them to go to, whether that is the crisis center at Oaklawn, whether that is Epworth Inpatient that I know is on the call, or Beacon Memorial Emergency Department. This is one of the things that may get expanded because it's legislation, that there'll be additional categories for people who are unsheltered in difficult weather circumstances where they're going to be forced to move inside. And if they don't go to one of these places, there's that possibility, as Marcy mentioned then, that they could be either ticketed or arrested for a Class C misdemeanor for their own safety and well-being. But again, we know that that still can be a very traumatic experience for people and doesn't help them break the cycle of homelessness that they are experiencing. We have a lot of great agencies that work to provide mental health resources. This is one of the flyers that we've shared with our police department here in South Bend, so that they're aware of all the different places where they can refer people. I would also say that if you're working with someone who is unhoused, who is not in a life-threatening situation, is not a danger to themselves, to you, or the community, these are all better places to call and contact as opposed to police, because this is who police are going to want to refer people to anyways. And so if you can not have to involve law enforcement, but can connect people to the resources that they want to have, this is a better way to get people the help they need when it comes to mental health resources. This is the kind of information that we're equipping our law enforcement with. I've talked about housing. I've talked about mental health resources. I also briefly want to talk about substance use services that we provide. We have lots of great agencies that are helping people do recovery in community, whether that is harm reduction or reducing the use, whether that is awareness of resources, whether that is treatment options that are detox, inpatient, or whether it's ongoing community support. We have a number of great agencies that are involved in this overlap of a goal of recovery in community. And this is another flyer that we've provided to our law enforcement here in South Bend so that they know about what options there are for people. The state law gives a 5-mile radius that they have to be willing to transport people to. So whether it's for shelter, for mental health services, or for recovery services, we want our law enforcement to know what's available, since this burden is now on them to provide that transportation and connect people to resources. And finally, as we talk about ongoing things that we are doing to help people, I just want to encourage you to think about the ways that you can get involved. I'd use a stair-step approach, and this can be helpful and maybe something you do within your own organization. or maybe if you're looking to get involved in the wider community. There's ways that you can give physical items that help people are in need. There's ways that you can get involved with your time and energy to help people. But what we see most importantly that people need is people to walk alongside of them when they're experiencing the trauma of being unhoused. We can do so much as service providers in our regular work schedules, but it really is going to take the wider community, as Marcy mentioned, for us to be able to accompany and relate and support people in the challenges that they are facing. Homelessness is very traumatic for people, and we want to do what we can here within the city of South Bend to not only connect people to services, but create opportunities for caring individuals to be equipped to walk alongside and support people in the difficult work that we are doing. Thanks everyone for listening and for being a part of this conversation as we seek to help those who are vulnerable in our community.
Okay, thank you, Carl. There are some questions for sure that we want to get to. I want to take a peek at this, but in the way that you're talking, Carl, is that the police are oriented toward connecting the unhoused to services. And there's some questions here about the southern part of the state, because we've got people from around the state participating in this call. So, is that unique to St. Joe County or to South Bend that you have a sheriff's office who want to connect to people? Or is, is that very local in terms of an approach? Or do you think do your peers around the state, are they suggesting that that's how it's going to be enforced in their jurisdictions as well?
Yeah, it really depends upon local politics, which are so varied across Indiana. You can find PIT statistics on your own region and some of the demographic breakdowns similar to what I shared for Region 2A. If you go to the state website for IHCDA, the Housing and Community Development, I know Region 2A, St. Joseph County, was the pilot for doing that nice graphic that I shared. They were working on doing those for the other regions across the state that we have. I don't know if they have completed those, but you can get your own PIT count data from the state if you want to understand those breakdowns or at least see it in graph form that is available for every region.
Okay, thank you. Here's a question.
Can I
Sure.
just add a thought to that, which is, and because we've seen this in other places, is, if there is in South Bend, sounds like there's a very collaborative law enforcement entity there. Um, are they willing to do outreach to their peer agencies in other parts of the state and offer support, offer ideas, offer the way that they're doing it there? Not every agency is going to come up with the best ideas on their own, but if they're willing to share ideas across the state, that could be really valuable.
Yeah, I know Marion County has expanded their EDO graphic already, and so we've seen a copy of that. I didn't share that because it's not very legible, but we are starting to share some of those resources. So Marion County has shared with us, and again, I lead a regional network of different cities, and so we'll be meeting again soon after July to talk about implementation and share the resources, and definitely include law enforcement for some cities. Like I think Lafayette, they have embedded workers within their police department who are actually leading their unhoused work for years. And so depending upon what the different cities and where that's centered and housed, there's more opportunities to work directly with law enforcement.
Okay. Carl, I have a quick question for you. What new church is taking people in South Bend?
I was referring to overflow at Weather Amnesty. We're working with Grace United Methodist.
Okay.
But what's the great thing is that the hub is still at Center for the Homeless. So people aren't showing up directly at Grace or any other overflow sites. But the Center for the Homeless is providing the intake. They're doing the evaluation for people and then determining who's the best people to send to different overflow sites. So I just say that with some hesitation, I want to give Grace United Methodist due for their amazing work and volunteering and giving their space, but make it clear that we're still funneling people through the center as the hub and entry point for anyone who's in need of emergency shelter when that starts up again on November 1st.
Okay, thank you. This question may actually be for both of you. You mentioned providing resources to local law enforcement. how engaged with addressing homelessness were they prior to the law implementation?
Yeah, I'll just speak first about South Bend, that we have a very responsive program. As I mentioned, crisis intervention team, we have about 57 officers across all three shifts who are involved with CIT, and so they're trained to know about resources, connect people to. We also have our community resource officers, or CROs as they're known, who are also very active, being out on beats, working with people and connecting them to services also. And then our crisis service unit with the sheriff is great because they're working with people who are in the jail when they're there and building that relationship. So when they're released and even out on the street, they have that relationship to follow up with them and help them connect them to services. So they've been tremendous in being able to help build that bridge. I think at our CIT week-long training we did this past March, we had 37 people from different organizations, whether that was cities, counties, Notre Dame, tribal, hospital, who were trained. So our CIT program has been very robust to make sure lots of different law enforcement are getting those trainings and able to engage with this particular vulnerable population when needed.
I had a question or a conversation with somebody yesterday whose son has serious mental illness and has been experienced homelessness. And his question for me was, how many officers are getting the CIT training, or is this a small group of officers?
Yeah, so there's some in all those different departments I mentioned. So for those locally, South Bend, Mishawaka, Memorial, Notre Dame, we've had some of our fire department, community paramedicine take it this past year also. So we're seeing a wide breadth, and more people are realizing that this is a need to get that training on resources and de-escalation, and get a chance to even practice it within the training of how do you interact with someone and have a positive outcome. We know our law enforcement have a lot of burdens already that they're trying to care for our community. And it's really admirable how many are willing to get this additional training so that they can be equipped and get people the help they need.
Yeah, that's great.
And
Marcy? Oh,
I can add to that, I guess, a little bit, which is like it varies, just like it does in the state. I think we are seeing more and more communities that are really trying to find these partnerships. In some places, you have like a hot team. You have even just one person that is responsible for this, and in other places, you have that one person who became a champion and has made sure that this becomes um, you know, a district-wide, citywide, statewide effort. Uh, and those are the folks that we're really trying to lift up and model. I think it's also just recognizing that they are, um, most communities are not resourced to do street outreach 24 hours a day, 7 days a week. And, our law enforcement partners are out there. I know that there are sometimes concerns about law enforcement, about the potential interactions. I think from our perspective, they're there. They're there, and it seems better to equip them with the knowledge, the skills, the training, the resources, the partnerships, than to just assume that are going to figure that out on their own.
yeah. Marcy, I want to ask you to talk a little bit about one of the responses that you mentioned was pushing for transparency and talking with lawmakers about the need for resources, right? So this is the conversation today. We've been talking about impact and defining the problem, and that our community in South Bend does have quite a bit of resources available, which isn't true in other counties around our state. So this idea of pushing for transparency and talking with lawmakers, I wonder if you could just talk a little bit more about what does that look like for just an average citizen?
Sure. Yeah, I mean, I think that thinking about, my favorite saying is that everyone is an advocate, whether you think yourself of as an advocate or not. Certainly, if you work in social services in any sort of way, you advocate for your clients all the time. So this is really just, how do you start to talk to your local lawmakers, your state lawmakers, your federal lawmakers, I think in terms of the transparency piece, um, okay, you've passed this law. Now let's openly and transparently track what impact it's having, and be willing to do make course corrections. Be willing to make improvements along the way. Um, so that I think is one piece. I think on the resources, I think it's always important to lead with education. Most people that are in decision-making chairs don't, they know what they know what they know, they don't know what they don't know. And so often they're led by narratives that they're hearing in the media or, other folks. And so I think just starting with having conversations, talking to your lawmakers, helping them understand the work that you do, the work that's happening in the community, uh, bringing in people that are clients, bringing in people with lived experience, letting them share their stories as well feels really critical and important. And making sure they understand what the resources that you do have are being used for so that they understand that you are using those resources as efficiently and effectively as possible. There's just not enough of them. Um, as opposed to just going and saying we need more resources, really showing them that feels really important. I can put a link in the chat to the Alliance's advocacy resources. We're always looking to expand our network and support in any way we can.
That's great. There is, we're running out of time here, but there is a question here about how do we approach getting more agencies involved in faith-based organizations? So I hear the word, how do we build collaboration and partnership? And if we have very limited services and need to find or hope to find other options.
Yeah, I'll just briefly say that We Make Indiana has been a great partner in raising issues. We've identified a data management system called Health Call that we're going to be using across our CIT trained officers, community paramedicine, Oaklawn's mobile crisis team that does amazing work, and my work also. And so that will be rolling out later this year to, as Marcy mentioned, the need for better data-driven analysis and collaboration. We're looking to do that. We have amazing agencies that are currently going out and doing outreach, whether they're faith-based or volunteer. And we're always looking for other options, again, to do that training and resources. I'm available, whether that's official organizations or volunteer groups. We have lots of opportunities to do that and develop that and have helped onboard others in the past. Would be glad to work with others who are interested here in South Bend.
So I think that the person who asked that question may not be in the St. Joe County area. So, I do think that you need to find out who is interested, in these topics. And law enforcement, your sheriff's office may very well be interested.
Yeah.
So finding out who cares about these issues, who's connected to these issues is what I would recommend is, just start meeting with people and having conversations and see where that leads you.
Can I add
Okay.
one thing to
Yeah.
that, Lisa, which
Yeah.
is like homelessness is intersected with everything else that's happening in your community. Whether a local organization even realizes it or not. Schools are helping or have kids that are homeless. So I think not just thinking about in terms of who wants to partner, but again, helping those partners in the community understand that this is already a part of their community, and working together is going to benefit all of our interests.
That's great. I really want to thank both of you, Carl and Marcy, for this conversation today. And I want to thank all of our participants. There were requests for the slides, and I put because we didn't require registration for this webinar, I put my email in the chat box so people can directly email me and I will send the slides out. So it's right in there. Thank you so much for being here today. Really important conversation, and I really appreciate what both of you shared with us. So thank you so much. Have a great day.
Thank you. Bye.
Take care. Great job, Lisa. Well done.